Hello everyone. So in today's video we are going to learn about the ophthalmology, and in particular in ophthalma which topic we will study. We will study about the visual pathways because so many questions were there in the pre-IQ which was about the visual pathway, like which defects or which anopia we will see. So first of all, before start this video, we have to first understand the basics. So in visual pathways, how the person can visually see the object and how it's actually pathway in our orbit or in our brain. So suppose these are our orbits, and from orbits this is one eye, this is the other eye. Here they meet, that is the X shape, and its optic chiasma it is. And after that there is optic tract. Then after that there is lateral geniculate bodies. Then there is optic radiations. Same structure here. This is the geniculate bodies, optic radiations, and in the last there is occipital visual cortex area. So suppose this one is a visual cortex area, okay, which is located in the occipital lobe. Now if we will think about the fields, so all the things which we will see, like which are in our temporal sides, like all these things field we see comes on our nasal side views. So the left visual field is on the nasal retina, and the right visual field is on our temporal retina. So here is our nose. So the areas, the structure which is around our nose, that is the nasal retina, and beside it is temporal retina. So this one, the green one is our nasal retina, and the pink one is our temporal retina. So opposite fields we will see because our eyes will rotate. So when we have to see like this structure, our eyes rotate like this, so field will come on the nasal retina. If we have to see like this, then our eyes will rotate like this, and it's come on our temporal side retina. Okay, so this is the first one. Now here from, so this is our optic nerve. From the eyes the optic nerves will come out, so it's optic nerve, and in the optic nerve these fibers, like the pink one, like the temporal retina side field, so the side one, like it is on the left side, so these fibers will go directly in the left side, while those fibers which are on the right side, so the nasal retina side fibers will go and on in the optic chiasma, they get crossed over here, so they crossed here. Same in the same in this side also, the pink fibers from the nasal field view comes on the temporal retina, and from temporal retina they come and they go without crossing with each other on the same side, while those fibers which come on from the temporal side views field view comes on the nasal retina, and they cross in the optic chiasma. So in the optic chiasma the centers, both eyes centers will cross, while the sides will not cross and they go directly. Okay, so this is the normal visual pathway. So here this one is our so here it's our optic area, temporal retina. Here is our optic nerve. So this one is our optic nerve. After the optic nerve we have this X shaped, so X shaped is optic chiasma. So this one is optic chiasma, and then after optic chiasma it comes optic tract. So this one is optic tract. This one is the lateral geniculate bodies. Then optic radiations will become, so this one is optic radiations, and after the optic radiations we have visual cortex area. Visual cortex area. So what kind of field we will see when there is defect in all these areas? So So first of all we have to remember, if there is defect in the optic nerve, means any defect before the optic chiasma is this part. So all the defects before the optic chiasma are located in one eye only, as we can see here. So if the defect is here, then only this eye will affected, not the other one. Okay, so when there is defect here, only we can't see from this eye only. Okay, so here is our first one, that is, if the defect is in optic nerve, means all the defect before the optic chiasma, we can say pre-chiasmal. So all the defects in pre-chiasmal lesions, what kind of field we will see? We will see defect only in one eye, that's why it's monoocular, and it's is like on the same side, so ipsilateral, monoocular and ipsilateral defects we will see. Okay, when there is optic nerve involved, or we can say prechiasmal lesions. Okay, when after that there is also defect in the optic chiasma. So what happens when optic chiasma lesions will be there? Optic chiasma means all these parts. So when optic chiasma lesions will be there, at that time we see bitemporal, means both sides of the eyes, bitemporal sides, bitemporal hemianopia will be there. Hemianopia will be there, means on both sides we can't see. So we will see in optic chiasma lesions bitemporal hemianopia. After the chiasma, means post chiasmal lesions, what kind of features we will see? Post chiasmal means after the optic chiasma, what kind of defects? Like if there is defect in the lateral geniculate body, optic radiations, visual cortex, or in optic tract, what kind of defects? So post chiasmal, the lesions we will see, in post chiasmals we will see hemianopia, quadrant, maybe quadrantopia, or we can see scotoma. Means in these structures bilateral eyes will be involved. In optic chiasmal lesions also bilateral, and in post chiasmal lesions also bilateral anopias we will see. Okay, so and in post chiasmal lesions mostly they are homonymous. Okay, in post chiasmal mostly are homonymous. Okay, homonymous means they can, if we put one eye on another eye, then defect will lie on one each, onto each other, so homonymous. So how we can let's revise, let's get in detailed one by one. So first we will take the defect in the optic lesions, optic nerve. So when there is defect in the optic nerve, so suppose here it is defect, so we can do, if the let me select the different color, maybe this one. So if the defect is here, so we can't see the this field view and we can't see this field view, means in one eye, the whole eye we can't see with that eyes if the defect is in optic nerve. And where the defect, if the defect is in the left hand side of the optic nerve, then we can't see through the left eye only, means it is ipsilateral. So that's why it is ipsilateral. Okay, in the optic chiasma, so in optic chiasma what will happen? So here, as we, this one is our crisscross. Okay, so if there is defect in optic chiasma like this, so we can't see through our which side, we can't see this green line because they only cross each other at the optic chiasma, so we can't see the temporal field view. So we can't see temporal field view. So in both the eyes, which area we will not see? Here this area we will not see, and in this side we will not see this side area. Okay, so because it sees like here's area and this one this side area. So this look, so this one will come when there is chiasmal lesions, means hemianopia bitemporal sides, both the temporal sides we can't see. Like in the left in the left eye we can't see the temporal side, and also in the right eye we can't see the temporal side. Okay, so that's why it's bitemporal hemianopia. Now after the chiasma we have optic tract lesions. So what will happen in the optic tract lesions? So if there is optic tract lesions, suppose like this one will come from the same side, and this structure will cross, okay, in the optic chiasma. So suppose this one will cross and it went like this. Okay, so this eye will see this area, this eye will see this area, means nasal field views, and the pink one will see the temporal field view. Okay, so if the lesion is here, means in the optic tract lesions, okay, optic tract lesions, what will happen? So when there is here, so we can't see from this area, because this area it's goes straight, so we can't see this area, means nasal field view from the left eye is not visible, and also the temporal field view in the left eye, we in the right eye we can't see, means this area from the right eye and this area from the left eye we can't see. So it's look like homonymous, means if we put this eye on this one, so both have the same area defect, means both have the same right side will be defected. Okay, so this is homonymous. So that's why if any lesions is present beyond the optic chiasma, then all have the homonymous hemianopia, means homonymous hemianopia will be there. Similarly, if the defect in the lateral geniculate body, so if the defect is in lateral geniculate body, for that we have to just remember that lateral geniculate bodies is supplied both by anterior and posterior choroidal arteries. So that's why in the lateral geniculate bodies we have the defect that is wedge shaped defect, wedge shaped defect, which is also known as sector anopia, which is known as sector anopia. So or also we can say keyhole defect. So these are the features, like in lateral geniculate body we see the keyhole defect, and what we will see in the optic radiations lesions. So in the optic radiations, like here in optic radiation lesions we have superior and inferior fibers. So if the superior fiber defects will be there, or if inferior fiber, so if superior fiber defect will be there, then it cause Baum's loop, and inferior fiber defect, then it is Mayer's loop. And please remember, in Mayer's loop temporal area will be there, like temporal area will be covered. Suppose this one is our brain, so in brain these fibers will cross like this, and they reach to the visual cortex area, while in the superficial they pass across the parietal area. So this is superficial and this one is inferior. And in the optic radiation lesions, in the we will see, either pie on the floor or pie on the sky, pie in the sky, pie in the sky, or pie in the floor. Okay, so pie on the floor, so pie in the sky it look like this one, and pie on the floor it looks like, so this is the pie in the sky, because after the optic chiasma there is by temporal areas will be involved, like homonymous area will be involved, so that's why both eyes defect will be there. And how the pie on the floor, so this one will be pie on the floor. Okay, so this one is pie on the floor, so we have to remember this one. And the last one, it include the visual cortex area. If visual cortex area will be there, then we will see macular sparing defect, we will see macular sparing defect, because the occipital area, which is known as visual cortex area, is supplied by two arteries, that is middle cerebral artery and the posterior cerebral artery. So that's why we will see the sparing defect, we will see sparing defect like this one, macular sparing defect. So in the last we have to make one summary table that which defect we will see when. So if the optic disc or nerve defect will be there, then the lesions will be on the same side, like ipsilateral we can say, like ipsilateral we will see. And also it is monoocular, only the single eye involvement will be there, so monoocular blind will be there. Okay, after when there is optic chiasma, so when optic chiasma will be there, then bitemporal hemianopia will be there. Hemianopia, bitemporal. Why? Bitemporal means in both the eyes only the temporal visual field will be defective, like in both the eyes this area we will not see, because it's suppose this one is our right eye, this one is our left eye, so temporal area, nasal area, nasal area and temporal area, because it's beside our nose, that's why it's nasal area, so we will not see the temporal area, that's why it's bitemporal hemianopia. Now the next one, that is optic tract. So if optic tract lesions will be there, then we will see contralateral homonymous hemianopia. Okay, because it involves the contralateral, means the defect is in the different eyes of the lesions. Okay, so that's why it's homonymous contralateral side, not the ipsilateral. Okay, when there is lateral geniculate body defect, then we will see either sectoronopia and keyhole defect we will see in the lateral geniculate body. And if optic radiations involvement will be there, then either we see Mayer's loop or we can see Baum's loop. So if Mayer's loop will be there, then pi in the sky will be there. And if Baum's loop will be there, so in Baum's loop we will see pi on the floor. How it looks? Pi in the sky like this, and pi on the floor like this. Okay, and after the optic radiations we have our occipital lobe which is known as visual cortex, and in this macular sparing will be there. We will see macular sparing. So this is the table for the visual cortex, and I hope it will help you while doing all the revisions. So thank you. Bye bye guys.